Welcome to the Every Mom is an Athlete podcast, where we believe that motherhood is inherently athletic. I see you lifting car seats, chasing toddlers, and carrying groceries one-handed while holding a baby and a coffee. Your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, entrepreneur, and mom of 3. Here you'll find solo episodes and real conversations with other moms and leading experts, so you can live your strongest, healthiest, most aligned life in motherhood. No matter how long it's been since you've had your baby, whether you're reconnecting with your body, rebuilding your strength, or just figuring out what feels good again, you're in the right place. Just a quick second for my pregnant mamas now. During my 3rd pregnancy at almost 40 years old, I had my easiest labor and fastest recovery, and I honestly credit that to doing my PregoCore program. PregoCore is a doctor-designed, by me, week-by-week plan that helps you stay strong, reduce pain, and prepare your body for birth, all in just 10 minutes a day. It works great on its own, or you can add it to your current workout regimen. If you want to train smarter through pregnancy and make recovery even smoother, head to the link below to check out PregoCore. And use the code ATHLETE for a special discount as a listener of Every Mom is an Athlete. Hello, strong moms. Today on Every Mom is an Athlete, we have Dr. Morgan MacDermott. Dr. Morgan is a licensed naturopathic doctor, mother of 4 young children, and a rising leader in the motherhood health space who blends functional medical expertise, clinical skill, and firsthand experience to help women and mothers navigate wellness for themselves and their families. She's the founder of Milk Medicine, a comprehensive online community of educational resources guiding women through the many transitions of motherhood, from pregnancy through birth and throughout postpartum. Dr. Morgan also co-hosts the Healthy as a Mother podcast with Dr. Leah Gordon, a weekly educational conversation around becoming and being a mother. I had so much fun having this conversation with Dr. Morgan, and I think there is just a lot for you to learn about having more of a holistic birth, and we will have to have her back because we need to get into so much more about postpartum, natural wellness, all kinds of fun things. So with that being said, enjoy this episode with Dr. Morgan MacDermott. All right, strong moms, we are back today. I am so excited to welcome Dr. Morgan here. She is a naturopathic doctor. And obviously, I've already told you guys about all her street cred, but I have just enjoyed following her so much. She has a beautiful, chaotic, lovely, holistic life, and I'm so excited for all she has to share with you. So thanks for being here with us today.
Thank you for having me. It really is chaos. We were talking before we started to record about adding more children and adding puppies and adding all sorts of different things to our lives, and it's probably the one thing that I do in my life that's very consistent, that's also very inconsistent with health, is like tack on too many things on my plate. But the reason why I do it, I think, is because most of the time the benefit outweighs the cost to me. Like in these moments right now, I do feel really quite overwhelmed. We literally just got a puppy 6 days ago. And I'm like, okay, I remember that. But then it's the short-term put in the hard work for the long-term benefit, of a dog and blah, blah, blah that has been raised around your family and all these different things. And so, but sometimes I do pack on a lot of stuff in my schedule. But again, I see so much joy and beauty in it. And like the moments with my kids all playing together, I'm like, all right, this is totally worth it. Like those 15-second things that you walk in on of them playing and having such a joyous, amazing time. It erases all of the months of difficulty or whatever it was that you're going through, at least for me. So I guess maybe the net outcome still for me is benefit and is still like health oriented in that kind of way you could think about it if you wanted to. But yeah, it's a lot. It's a lot going on over here.
It's just like everything in life, right? Like all the things that are worth it take some work. So, here we are doing the mom thing. So tell us a little bit about yourself. I would just love for you to tell our audience a little of your background and what you do and who you are.
Yeah, awesome. So I am Dr. Morgan MacDermott. I am a naturopathic doctor specializing in the perinatal women's health space. So pregnancy, birth, breastfeeding, postpartum, a little bit of pediatrics as well, because it's sort of just the natural flow. And then, of course, motherhood and women's health in general, of just the idea of thriving in this setting when there is so much on our plate. But I do believe that motherhood can be really intentional and joyous and rich and fulfilling and all of those things. It can also be really, really difficult. And I am not somebody who finds motherhood to be easy, which I think surprises people because it is something I'm obsessed with. And I continue to put myself in this position of having more and more kids. So I have 4 little kids, 9, 6, just turned 5, and just turned 2. We're considering having another. So maybe, look out on the horizon for 5. My husband and I set out to have 3. And then as soon as the third was born, I knew there was a fourth, just in an intuitive, very deep intuitive way, spiritual way. I cannot explain it. It's probably like the one thing in my life I'll never forget as my most intense intuitive knowing that something was going to happen, even though I didn't want it. That was the other thing that was weird is I did not want a fourth baby. And I was really overwhelmed with three. And my third was the hardest. She was the worst sleeper. She's such a great sleeper now. And she's so mild and sweet now. But as a 0 to 2 year old, it was really tough. And so this constant nagging idea that there was this fourth baby was like so bizarre to me. And then, of course, she was an oops. Like this method we've been using for 12 years in our relationship failed this one time. And I knew it could happen, obviously, but I was like, wow, okay. She was meant to come, the fourth was. And she's been so joyous that now it's led us into wanting to maybe have 5. And so anyways, but motherhood is not like an easy thing for me. I do find a lot of joy in it, as I said, and I try to hunt for those little nuggets in those moments. But I have had really horrible postpartums and poor mental health in moments, and the whole perfectionist thing, and being a mom with ADHD, and like just feeling so split, and having my own work from home business with little to no childcare and homeschooling. Like, I mean, I could have carved an easier path for myself. That's probably true. I could do things to make it easier. But I'm really stubborn in the things that I believe in. And with these values of homesteading, homeschooling, etc., we've just decided that like we're going to double down, and it's not going to look perfect, and it's still going to be okay, and it's still going to work. My husband works from home a lot of the time. He does still travel too, so he's on board with it. He's in there, and we've just had to adapt as over the years go by and things. But my most favorite thing to do is talk to other moms and women becoming mothers, because I run an educational platform on my own website with courses and things to prep women. And then I also co-host a podcast called Healthy as a Mother with another naturopathic doctor, my best friend, Leah Gordon. And she talks about things in the like IVF, preconception, menstrual health, fertility, infertility, low libido, sperm health, all of that side of things. And then I pick up once you're pregnant. And then I talk through the whole rest of the line of being pregnant. So really together, we cover the entire span of this time period. And it's really amazing and so fun and fulfilling. Again, that's the whole thing. Yes, of course it's hard. Yes, of course there's challenge in that, but it's so fulfilling. Like it's just, that's I think why I keep doing it, why I keep going. And I also really, as my own self, I'm kind of like my own target market, I guess, when I'm talking to these women, and I'm trying to think about us when we're like 80. You see those reels and memes going around, and it's like we are living the days right now, even if it feels so crazy sometimes. And there is a frame shift that I pop in and out of, and I can't always stay there. And I wish I could. I think some women do. But then I also think some women never get to that frame shift moment in their mindset where they're really viewing what's happening before them with their days of little kid time, pregnancy and birth and postpartum, and see the beauty and the joy and how you're really like peaking in life right now. So I always like to draw attention to that and kind of bring us back around that, like, we're in our 30s and 40s, and it's like, this is the jam. We have to find the joy in it too.
Yeah. Oh man, we could just talk about that forever. I do want to say one thing that you mentioned is I actually don't think that moms stay there. I think that's impossible to stay in that completely like zenned out, blissful, this is beautiful place. And I think that we think they do because like Instagram tells us that they do, but they actually don't. And I think people like you do a great job of showing like, yeah, this is such a beautiful moment. And then like look around at like what's happening, like there's chaos here. Like I'm not calling your house a mess, but you know what I mean? Like there's dishes here. There's like, my house is a complete mess. So I don't even try. I think if you can grab onto it a little bit each day, that's like really like the magic, because we can't stay in that. It would be impossible. We'd be like mentally ill probably if we did,
Yeah, no, you're probably absolutely right too. And the same thing stands for anything health related too. And this is an angle that my podcast co-host and I like to talk about a lot is the natural health world, the fit, healthy mom world can be really dogmatic. And that in and of itself can have such a toxicity to it. And it's like, we need to be able to have this balance and pop in and out of what's important in that moment, what's important for you overall. Everyone is going to have different thresholds for where they have their absolute no's, to things, whether it's like fast food or whatever, screen time, like something. Everybody's going to have their different philosophies. But when every single thing in your life is the furthest, most extreme dogmatic philosophy, it's really probably rare, if not impossible, for someone to have good mental health in that setting too. And it does have to pop in and out. And I think that's something that people are surprised about with me is how, yes, I am a naturopathic doctor. And yes, I do really value in so many different ways being as natural as possible in a lot of different areas. And I am realistic and balanced and not going to dig my heels in a setting where I'm just denying reality. Like, the reality is that in these moments, there are times where we're going to have the airplane snacks or the like whatever, or they're going to watch a movie and it's okay. They're going to watch a movie and then they're going to watch another movie. You know what I mean? It's not common. It's like that 80-20 rule thing. I think a lot of people though are really afraid to admit that that's what's going on. And I am a loud admitter, I guess, of where, because then I mean, my husband thinks I'm extremely strict. And I am overall, but again, I can give, and we have to give and take. Otherwise, it just takes over our entire mentality. Like for me, okay, I know you're a very big person in the fitness world, and I really, really admire that. And it's not ever been something that I've been into personally myself. My form of exercise is really minimal. It's like I laugh because it's inconsistent with what I quote unquote should be, what I know should be true. But the things that make me feel good are like long walks with my dog in the cornfield. And then I'll do this set of weights, this little like circuit on my vibration plate. And then I do like 10 minutes off of it too. So the whole thing takes like 20 minutes. And I do that 3 or 4 times a week. And that's good for me. Like I'm chilling.
Yeah.
I feel strong. I feel good. Could I do more? Maybe should I do more? I mean, I don't know who says.
Yeah.
But it's like, that has been one of the things that hasn't integrated deeply into me, where that is like a larger habit or whatever. And again, I still think it's okay because there's different ways that we can do it and achieve our health in a way. You can't do zero exercise and expect to have health. You just can't. But it also doesn't have to be so much. Same thing with these, like taking all the supplements or every single home cooked meal or zero screen time no matter what, 90s childhood. It's like, yeah, we all want that, but we're not. It's 2025. Like it's just not happening sometimes,
Also, I watched a lot of TV when I was a kid in the 90s. So
Same.
I'm
It
like,
was a little different, but yes,
totally.
you're right.
I'm like, when I was like, I think we're being a little bit like, what's the word? Where you look back on it and you're like, that was perfect. What's that word?
Oh yeah, like rose-colored glasses.
Yeah,
like,
totally. I'm like, okay, yeah, we played outside a lot, and I watched Saved by the Bell for hours. So let's be realistic here. Okay, let's get into, I want to talk a little bit about holistic health and like what that means. So what that means during pregnancy, during postpartum, during motherhood in general. I mean, we're already sort of alluding to it, right? Which is like just kind of looking at the whole picture. But I think people hear the word holistic and maybe like don't even really understand what that is. So let's start there.
Great question. So a lot of the time people will mix up some of these terms. They'll say holistic and then they'll say homeopathic and naturopathic, and they're like, what are all these things? Okay,
Yes.
so holistic means that you're looking at the whole person and their whole situation, their whole body, mind and spirit. So everything. You're not just going to a cardiologist who's only going to look, okay, like the other day I took my daughter to the ENT. I don't know what I was expecting. I got exactly what you should expect. And I think I was like hoping to be the exception to the rule where he was going to have a more holistic conversation with me about her airway. That did not happen. It's okay. The medical system has flaws. And he literally looked in her ears, nose, and throat and then talked about surgical options, told me there is no pharmaceuticals that can reduce the size of tonsils and adenoids, which I knew, but like it was either surgery or meds, and that's it. But so that is not a holistic view on the whole person. There was no conversation about food allergies, allergens in the home, other things that could be contributing to the size of the adenoids and the tonsils. It was just, this is what I can do because I'm an ENT doctor. Now, a holistic view on health would be somebody who is asking you, what is your life like? What's your stress levels at home? What are you eating breakfast, lunch, dinner, snacks? What's your best habit, your worst habit? How do you feel? All these different things. What do you find fulfilling? Making sure that there is a life purpose there on top of things like, how many hours a day are you sleeping? And why are you not sleeping so much? Is it because you have anxiety? Oh, what do you have anxiety about? It takes a lot longer. It's an hour and a half long conversation usually as a first patient appointment. But then the word homeopathic, people will say, and I think what they mean usually is natural. Like they're trying to say naturopathic or holistic, but there's this word homeopathic. But actually homeopathy is an entire field of medicine where we're using a homeopathically prepared remedy or medicine made from usually like a plant or an animal or a natural mineral like a rock. And it's prepared in a specific way. That's like those little tiny white pellets that you see in the blue tubes at the health food store. Those are homeopathic remedies. So homeopathic actually has a meaning, and it's a very specific type of medicine. but sometimes people mean naturopathic or holistic. And a naturopathic doctor is trained as a primary care physician. So I did not do a residency. You can. There are some residencies available. They're not required and they're not enough for every doctor graduating to go take one. You have to, if you want to specialize like I did in the perinatal women's health space, you just have to kind of piece it together yourself. Nobody's going to be overseeing you to say that you're like a perinatal naturopathic doctor. You know what I mean? It's just based on my own additional trainings, courses, and things. And so I am able to, depending on the state that I live in, do various things, prescribe medications, which sometimes I do, but that's holistic health. So it's like, if I can take care of it in a diet, lifestyle, herb, supplement way, I will try because my goal is the root cause. Now, as this relates to pregnancy, it's really frustrating. This is one of my hills to die on, is the idea that pregnant women and postpartum women specifically are really left in the dust in this space because OBGYNs, bless their hearts, they're surgeons. They are under this model that does not work or serve in the insurance model, where they have a 7-minute appointment with a woman who they're trying to build a relationship with, who this woman doesn't even know that she's very unlikely to actually birth with that doctor. She's going to birth with somebody on call. The doctor doesn't say that. There's no conversation about it. There's no conversation about what do you want your birth to be like? What's your birth plan? What do you think about birth? What are your fears? How can I help you with these? What are the options? Or maybe they go and they take a birth class inside of the hospital, which is really just a patient compliance class. This is what you're going to do. You're going to come in here and then we're going to tell you to do this and then you're going to do that and da, 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 da. A lot of the time, not every single time, but it's just that is the standard model. Unless you are actively looking for an alternative, you're looking for a midwife within a hospital system, or you're picking an OBGYN who has a better reputation for supporting physiological birth. Physiological just meaning like they have a low cesarean rate, or they're not super induction happy. Like they're not going to induce everybody just because, and because they actually do value and see that there are negative consequences with those kinds of things. If there's a medical induction need, if there's a necessary cesarean, thank God for it. You know what I mean? Totally. But there is times where women are pushed into these things and they just don't even know. And I find that to be sad. And so with pregnancy health, it's like things like preeclampsia and gestational diabetes. There are earlier signs that these things might be taking place, that there's no conversation about diet, lifestyle that could be happening throughout the entire pregnancy. There's almost no conversation about diet in a conventional setting with pregnancy, except for don't eat fish, don't eat lunch meats, don't eat drink raw milk, blah, blah, blah. There's no here's the nutrients that you could really focus on that we know are research supported to help your baby's brain development and their nervous system health. And hey, let's check your vitamin D status. Let's check your thyroid. Nope, none of that's on the prenatal testing. They don't care. They just want to know, do you have hepatitis? Do you have HIV? Are you rubella positive or negative? You know what I mean? It's just not actually focused on the entire health of this mother, and then now the new baby being born. And in postpartum, it's even worse. I mean, you get your 1 6-week appointment, and so much has happened in that first 6 weeks that could have been better supported, whether it's with breastfeeding and all of the challenges that breastfeeding can present, especially the very beginning. And breastfeeding is such a time-sensitive thing that if we're not like really getting it in these first couple of weeks, it's gone. Poof. You're not going to come back from that. And so midwives, I'm a huge fan of. Obviously, I'm also a huge fan of the OBGYNs that are going to go deeper. Doulas, all of these other people, they have to be on your team, but there almost needs to be an additional profession who is, because the doctors can't do it all. They just can't, they cannot fit it in. And that's not because they wake up every morning, they're like, I can't wait to just skim the surface with all the patients.
Yeah,
you know what I mean?
totally.
They're not this consciously. It's just the system does not support it. And there is so much that needs to be talked about. And so, I mean, that I've kind of put myself in that position where I think there should be a profession. And so I'm one of those people trying to change this narrative, because the saddest thing to me is a situation where a woman has an experience that's negative, whether it's with her pregnancy, her birth, her postpartum, her breastfeeding, et cetera, her initiation into motherhood. And she goes, man, I wish I would have known, or something to that extent. I had that with my first. My first pregnancy was great. The birth was really long and hard, but it was great. The postpartum completely changed my entire life. It was the dark night of the soul that I never knew that I could have, sort of a situation. And rose up out of it, blah, blah, blah. Obviously, it has a huge role into the way that I think and function now, and also spurring my passion. But I just did I need to go through that though? Did I have to be sweet little 26-year-old, new mom in the world suffering so greatly because I wasn't supported in any of the ways that I really needed it? And I didn't even know that I needed that support, So I just wish that women weren't left in the dust so much like they are. And holistic care helps tries to round that out so that that doesn't happen.
Yeah, gosh, you said so many great things there. It is, obviously I'm a chiropractor and I don't have any prescription rights. And like, depending on who you ask, I'm like got a weekend certification as a doctor. But all that to be said, I also like feel very strongly about this, just like some of the knowledge, that we have learned over the years as doctors, but also as mothers and just people who like are diving into these like different areas. I do mine in more of like a fitness related way, but there's so much stuff that like I tell my patients, I'm like, it's not the OB's fault, to be honest. It's not their fault. They are, generally speaking, doing the best for their patient. But their job is to make sure mom is healthy, baby's alive, everyone comes out of this like relatively physically unscathed, right? And that's all they have the time for. And that's, again, like a longer conversation about how broken our medical system is. But I think that, we can help with just like, here's some stuff that can make things a little bit easier. So what are some of your like, I don't know. I know this is like such a hard question, but what are some of the things that you like to talk with maybe new moms or first-time moms or, pregnant women? What are some of the things that you wish that they knew that they're not getting from their OB?
I think I wish that they knew, okay, there's a couple of different things. First of all, if you have the luxury of doing a preconception period before you get pregnant, meaning the luxury, meaning like you didn't, like accidentally get pregnant or there was a big, strong time crunch because of age or other factors where you just have to go into some sort of like fertility treatment or something is happening. If we have the wherewithal to do it, I think the preconception chunk for both you and partner for 3 to 4 months is really, really amazing and helpful. I'm not going to get into the details of that right now, but I think that that's something that I wish so many people knew, and they usually don't. And they find out about that concept later, and maybe they do it with their subsequent children, second, third, whatever. But first-time moms, I think that's a kind of a new concept. Secondarily, I wish that so many first-time moms during their pregnancy would get a doula.
Yeah.
So a doula is not somebody who is going to check your cervix or be medical. They are literally labor support people. And even if your plan is an epidural, I want you to know some of the things about that, which is that 10 to 15% of epidurals do not work. An additional percentage of them work only one-sided. There's going to be a certain percentage of women who have a fast labor and they cannot even get it, or that the anesthesiologist in the hospital is busy. So it's a plan. You can have it on your plan, but you also have to have really strongly fleshed out plans B and C and D and E and F, truly. And a doula will help you with achieving that goal and also being able to be there to pivot, because in most cases, your partner's a man who's never given birth himself, who knows nothing. And if it's just you and him and you're trying to do labor at home and then go to the hospital and maybe you've transferred too early and they send you home because you're only 1 centimeter, but you've been in labor for 12 hours and you don't know why, and these contractions are really hard, and someone, quote unquote, someone, aka the doula, is the person who can say, okay, I think maybe this baby's not in the right position. Let's do some positional changes. Let's, do a side lying release. Let's do the Miles circuit, some of these things. And then we can get the baby locked and loaded so that your contractions are more effective, so that you're more comfortable. I'm going to make sure that you're eating and that you're resting. We're finding different positions. Your partner is able to take a break and go eat and take care of their own bodies and selves. There's so much. You guys, I work with hundreds and hundreds and hundreds of families. I mean, probably into the thousands now, where I have never, not one time, heard somebody go, man, I wish we didn't have the doula.
Yeah, true.
No one says that.
True. Yeah, like you said, even if they plan an epidural, it's still so helpful, right? Because then, like you said, they probably wouldn't show up at the hospital too early, and they would be able to find these different positions and find some different things that are comfortable. And they're so helpful. I've had doulas with 2 of my births. One was a breech, a C-section. So I did not have a doula for that one. But had he been like, even if I knew I was going to have a C-section, I think I still would have had one just because of that like whole process.
Yes. I mean, it's an added cost for sure. And this is kind of a crazy sentence to say, but birth is more important than a wedding. So if you need to take off $1,000 from your wedding budget and shove it into your future thoughts and planning of having a doula at your birth, I think in the overall scheme of things, you will really think yourself. Like, say no to some additional decoration that no one's going to notice that you also don't care about. Say no to some other additional, I don't know, food item or something, and save that money for your birth, because it can be something that makes or breaks women. It sometimes is kind of like neutral. It's not necessarily like a groundbreaking experience for some people, but I guess it is an opportunity though to be something incredible. And it also is an opportunity to traumatize you for life. Unfortunately, it's a very fine line there. And it's not any one person's fault in general. It's usually many little things kind of going wrong. But a doula is able to voice your opinion when you cannot have a voice because you are in the throes of labor land. And we want you to stay in labor land. You don't want to be your own doula. You don't want to be having to make these decisions. It's a care team thing. Okay, you have to think about labor as like you're under the influence of a very heavy psychedelic drug. Okay.
Yeah, true.
And you want to be led by like a really experienced, wise shaman, right?
Yeah,
Who's going to take
yes.
care of you and who's going to make sure that you have a good trip and a good experience. And the doula is that person. Your partner is also very helpful and they know you in a way that the doula can never, but they also don't have the additional knowledge to know how to exactly make you more comfortable or how exactly to look at your contraction pattern and say, I think this baby needs to be in a better position or etc. There's 100,000 things I could say. Does your partner know intuitively just from being born and living in life that giving birth in a dark, quiet, warm space is probably what would be better for you? Probably not. I don't know if he or she would know that. So it's like the doulas manage all these little things. The doulas can also interface with the nurses and the staff, and they can say, okay, you know what? Let's give her one more hour. We're okay. They're like, yeah, we really want to start pitocin. She's not progressing very fast. It's like, okay, thanks. Come back in an hour. We're good. We're good here. The doula can be that person, so you don't have to be that person. So anyway, that's one thing. There's a million different things here, but then the other additional thing I'll say for you pregnant women is take some kind of a breastfeeding class or meet with an IBCLC, International Board Certified Lactation Consultant, prior to giving birth, if you can. Because hospital lactation consultants, if we're giving birth in the hospital, are notorious for just being just okay. And it's, again, not because they wake up in the morning and they say, I can't wait to go give mediocre advice. That's not their goal. But it's because of the model. They do not have the continuity of care of following along that woman and baby, mother dyad, over a long period of time to see, was their advice true? Was it helpful? Was there something else that came up later? Did that baby actually end up being tied? Was a release helpful? Was it not? Was the baby tied? Did the mother's inverted nipples affect things or not? Did she have low supply? What was going on? They're not learning any of this. They're literally just saying, okay, here's a different way to position the baby. If there's huge anomalies going on, they can maybe make that advice. But more than anything, probably I've heard a lot of damaging advice given by hospital lactation consultants because it just isn't something that ends up being true in the long run because they don't have that knowledge, unfortunately. Now they try, and a lot of them are like lactational nurses, but they'll say things like, a 3-day-old baby that's crying, oh, I just don't think they're getting enough milk. You should probably give formula. And it's like, hang on, do you know anything? Is a 3-day-old baby expecting to get like a 3-ounce bottle of milk? No. A 3-day-old baby is expecting to get drops of colostrum many times every about hour throughout the day. We don't wait 3 to 4 hours to feed our newborn babies. We are feeding them usually about every 1 to 2 hours and just also like watching the clock, not watching the clock, watching their cues.
Mm-hmm.
Feed the baby, not the clock. Okay. So anyway, that is another huge thing because the breastfeeding, if you have the intention you want to breastfeed, and especially for the women who are really, really set on it, it can be such a tragic slap in the face when things start to fall apart right in front of you.
Mm-hmm.
And you're trying so hard. And again, like I was saying earlier, the hormone loops and just the nature of the cascade in which breastfeeding needs to take place in order to be successful in those early weeks, it's a finite amount of time that if we don't figure it out, it's gone or it's inadequate. Maybe you're not going to make enough because there wasn't enough stimulation at the breast. There wasn't enough milk removal because the baby had a mouth that wasn't able to remove the milk, or you weren't pumping on a proper schedule because the people in the NICU told you wrong, or something happened. You know what I'm saying? There's so many of these little details to know. And motherhood in general is always such a like learn on the job situation. But if we could go into it having like at least some knowledge, wouldn't that be better than none? So I really, really stress that kind of cascade of things. Preconception, if you can, getting a doula for your birth, and then being prepared for breastfeeding as you head into postpartum. There's a lot of other things to be prepared for in postpartum too, but I think that the whole world of breastfeeding is primarily what you're doing if you are going to breastfeed. And so it's something that like no one can really understand and grasp until you're doing it, how much of your life is going to be consumed by this in these early weeks and months. It gets easier. The baby gets more efficient. It's not the rest of your life. I don't say this to scare anybody or to be like doomsday-y. I breastfed all my babies, but through really, really hard situations of them being lip and tongue-tied. And it's hard for me every single time. And it's one of the huge things that when I think about having another child deters me because it is so hard for us. And I am proud that I've worked through it, but I say it in this way because I'm like, oh my God, but it would just, if I just didn't have to do that. But anyway, my point is that you don't know if you're going to be the one to have problems. Some people don't have any problems. They just put the baby on the breast like you think in your mind you're going to, and boom, like it's amazing. And I wish that for every single person. And I'm not going to be naive to say that that's going to happen. So we need to have the knowledge in case it's not going that way.
Totally. I think two things I want to just chime in. One is, depending on where you are, just for listeners, hospitals in my area, I know, have doulas on staff. And so I always tell
Where are
people,
you?
I'm in Seattle.
That's amazing.
Yeah. And so, I mean, sorry, I shouldn't say on staff. They are on staff. You still have to pay, but it's a very reduced rate. And so just something to look into if there's also some doulas who will do a discounted rate. So just start looking into that. Even if you're like, this is not something I can afford, it might be. So I don't want to harp on that too much more, but just take a few extra steps to look into that. Also, I will say that as mothers, you said you never know what's going to be hard. And we all have different hard things. I actually was one of the ones who was like, boop, breastfeed, here we go, no problem. But like we had struggles in other areas, so it's never going to be, I think you look at someone who maybe had an easier time with something, their struggle was something else and maybe something that was easy for you, So I just think we have a hard time remembering that sometimes, that like all our struggles are different,
Yeah, they say that it's like of the three things, if you were to break it up into three, the pregnancy, the birth, the postpartum, usually two are going to go like more well, and then one is going to be your struggle point. Of course, there's going to be situations where all of them are hard or all of them are relatively okay, but it's going to be something else. Like no one lives a perfect life. And it's okay. So we just have to expect that this is going to be a wild ride. It's a rodeo. It's so worth it. And it really, even though the days feel so long, the years are so short, and then boom, it's gone. And all of a sudden you have a 5-year-old and you're just like, what is going on?
I know, it's wild. So wild. What are some little things? Like, do you have any little daily rituals that could make a big difference for women during pregnancy that are maybe, things that you as a naturopathic doctor would recommend that they might not get from someone else?
Yeah. Okay. So I want, first trimester is going to be hard usually for most people in terms of eating well, and you have to give yourself a pass. You also may not take a single supplement, but if you can transition your supplements to things like gummy vitamins, I actually don't think that the Smarty Pants organics are that bad. You just need to eat like 5 or 6 of them.
Yeah.
The dosage is lower because they're gummies. So you need to like almost double it. I can't remember if that's exactly right now, but if you look at the back of the bottle and you compare it to something like Needed's prenatal multi, figure out how many gummies you need to eat to get to those better dosage levels and eat the gummy. It's okay. Once we start to feel better, we do need to try to focus on about 100 grams of protein per day. I think that can be so preventative of many different issues. Preeclampsia, gestational diabetes. There's so much going on in our bodies. We really need to be able to give the building blocks for this process to go off seamlessly. I also really find a non-negotiable to be like a 30-minute walk per day. And I like to habit stack that with listening to birth podcasts. So if you have hills in your area or stairs or something that's steep, that's even better. Kudos to you, especially as you become closer and closer to your due date. I think a hills or stairs set for every woman every day, if you could, is so helpful for just activating all of those muscles in the hips and the butt, lower back, getting blood flow, baby in the right position, helping tilt the pelvis. The shifting of the stairs helps get baby kind of like, a lot of opportunities of movement. If you are somebody who works from home, or sorry, not even works from home, if you work where you're sitting down at a desk a lot of the time, set an alarm on your phone every hour, where you're going to get up and you're going to move around for 90 seconds. Then you're going to sit back down. But every hour you need to be getting up. It's so easy sometimes to just sit for like 3 hours in a row. And when we're pregnant, it's not ideal. So if we can be doing these little things of movement, little things of choosing good, high quality foods, and with a goal of something like 100 grams protein per day, lots of water, electrolytes. And then, there's little easy things too. Like whenever I'm brushing my teeth, I do like 50 squats. So twice a day you're doing 100, or in the day you're doing 100 squats total in 2 sets of 50. I think that can be so valuable. And as throughout your whole pregnancy, as you gain weight, your muscles will adapt to that different weight load. And it just is going to, again, like help with firing and activating everything. If we're doing it properly, we need to make sure we're doing it properly. And then with things that are healthy habits that are difficult to remember, if it's like you cannot remember to take your supplements, alarms on the phone, putting them by your makeup, like get one of those little supplement organizers like you're 90 and
Oh
they
yeah,
are
I
so
got them.
helpful. Oh, I know. Me too. They
So
are
many.
so helpful. Yeah. Have a little something set out where you have a little checklist every day. Can I get this done? And I think really protecting your space too in pregnancy. I suggest to all my clients, patients, pull away from things like the news,
Mm.
pull away. It's just not your time. And some people have a really hard time with this. They're like, I need to stay informed. I need to know what's going on in the world. I can't just it's a privilege to be able to pull away. And I say, yeah, it is a privilege. You're so right. And you're going to exercise that privilege for the next 9 months because your space and your energetic, you do not want to be living in the
Mhm.
swirl of somebody halfway across the world is suffering that you can do nothing about. It only leaves hopelessness. And you can worry about this or maybe make actionable change or be more aware when your energetic body is not so focused on creating a new human right now. I think that is a powerful habit. And same thing goes with like toxic relationships or people not engaging in conversations like that or putting up some boundaries if you need to. Things like that. Like my parents were starting to separate in my 4th pregnancy and I had to just be like, guys, I'm not talking about this with
Yeah.
either of you. I can't be your support person. Like I love you both. I want to see you happy. I want, we're going to be amicable and everything's going to be good, but I'm not like therapist for anyone. I'm not going to like partake in these conversations because it was, really sad and heavy on my heart and
Mhm.
not something that I wanted to get involved because the tensions were really, as one would assume would be where they were really high. So anyway, things like that, if you can. And then packing your subconscious, like with the birth podcast while you're walking, packing your subconscious with positive stories. I mean, I also personally, like, this doesn't bother me to listen to the traumatic birth stories because I was learning from those. I like to listen to all of it because I feel like there's lessons gleaned. But you know yourself, like if you will hyperfixate because you have a deep fear about birth and you'll hyperfixate on all the different ways that it can go wrong, then don't fill that in your space. Listen to the Free Birth podcast because those are women who are doing things with nobody around,
It's
no
wild.
help.
Yeah.
I also like the Birth Hour podcast.
Yeah.
It's a lot more like blended. There's hospital births, home births, birth center births, etc. But do you know what I'm saying? Like when someone's training to run a marathon, they're not going to shy away from every story of people running marathons and what their experience was like.
Right.
They're also maybe not going to focus only on how some people died when they run marathons or break their legs or get rhabdo or something like that. They're not going to focus on that. They're going to try to get a bit of a blend maybe so that they learn and that they feel prepared and that they can learn from other people's mistakes, make some different pivots and shifts, have different plans if things arise. We cannot be naive to the fact that birth is wild and unpredictable and sometimes things do happen. So that's where I think like a good base level of education has to be there so that you can have it in the background and then you're experiencing it in real time and you can make in moment pivots and shifts as needed. Again, hopefully with the help of a doula. But so yeah, I mean, those kinds of daily habits for a pregnant woman would be moving your body, staying in a good headspace and eating as well as you can, but also giving yourself grace.
Yeah, that's super helpful. I think, especially talking about the headspace. With my last birth, my doula, which I just adored her, she was a pelvic floor PT before she was a doula. So we just like really vibed. But I remember we were preparing like my birth plan and she was asking what I wanted. And I did. I wanted an unmedicated VBAC and I got it. Thank God, which is like, it's just a miracle because you just feel like nothing ever goes the way you want in birth. But I remember I was saying to her, I don't know if I want to plan like on my birth plan for the C-section. And she was like, Karlie, you are not that powerful. Just because you make a plan for a C-section does not mean it's going to happen. And I say that to my patients now because I think back to it and I'm like, you know what? I actually had a great C-section experience in my second birth. And there were parts of that if I ended up in this third birth with a C-section, I would want those things to happen. And so that's like another thing that I think is like really listing out, like you said, plan A, B, C, D, E, like that can be really helpful. And it just gives you some things to think through and like not fixate on, but like just not feel like you're like putting on the blinders, like, oh, that's not going to happen, not going to happen, not going to happen. Like, well, if it happens, like, don't you want it to go the best way possible? So I always recommend that for patients too.
I'm so glad you said that because I think that the net effect, some of the most traumatic experiences that I've heard of for women is when they didn't walk through all of those other ways that it could go. And then they had never thought about it before. And so it was all scary and it was all traumatic and it was all very like, wait a minute, I didn't even know about that. I didn't even know that that thing existed or that was an intervention that could happen. I didn't know that you could be put under general anesthesia for a C-section. And so then here they are in the moment, it's happening to them. And then, so the overall net effect of the experience was far scarier and worse than it needed to be had they like walked through in their mind. I agree with you. You're not going to manifest it just because you've thought about it. I think it's really important to be able to say, okay, if I'm in the OR, I'm being wheeled back to the OR for whatever reason, hopefully it's a good reason.
Yeah.
But, sometimes it's life or death. And then sometimes it's also like a shared decision making in, this is just not happening and we don't know why. And I am at my end because here's the thing, at the other side of birth is motherhood. And
Yeah.
you need to be present to your baby and you want to not be at your absolute most peaked, wrung out, exhausted. And this is something that I used to not really think. I used to be such a staunch, in my naive, like younger years that no, our bodies are made to birth and like, not that there's no reason for C-sections, but they should be like very, very, very infrequent, da, 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 da. And it's like, no, I mean, I've seen it now time and time again too, where for whatever reason, it's not happening. And do we push this woman on like a 2 or 3 day Pitocin induction just for the of it? And then maybe the baby crashes out and now we're having an emergency C-section? Or do we just say, you know what? I think we've made peace. Like we're at this point and it's going to be okay. And we're going to go in for a really present birth. And then you have the energy to mother this child on the backside of it.
Mm-hmm.
And if you've had a couple of these mental exercises throughout the pregnancy and maybe conversations with your team, the doula, your partner, your provider, maybe then if it happens, as you're being wheeled back to the OR, you can have a moment of, a 15-second moment of peace in your mind where you're saying, okay, baby, you have I'm talking to my baby inside my head now. You're going to be born. You're going to be born right now. It's going to be a little bit weird. It's not what we thought was going to happen, but I'm so excited to meet you. Everything's okay. I'm going to take some really deep breaths because my breath is my baby's breath. The oxygen that I'm taking, I'm not going to hyperventilate and freak out and panic. I'm going to be as calm and strong and mother bear as I can for this baby in this moment, although it's not going the way that I want it to go. But it is right now. It's happening. Like we can't fight against it. You see what I'm saying? It's like, I think there's a lot of benefit in being willing to accept that as a potential reality sometimes.
Totally. And I think too, in that specific instance, there's a lot of things that could happen in that OR that could make you feel like it was a more natural experience. Like I breastfed my second son on the OR table. And I remember I was at this seminar it was a few chiropractors, but mostly OBs, midwives, and doulas and nurses, a lot of like the delivery nurses. And I told them that I was like, yeah, in my second birth, I was able, because it was a planned C-section, I got my son on me and within a few minutes he was nursing on the OR table. And they're like, really? They let you do that? And it was so crazy to me that these delivery nurses didn't know that that's like a thing that can happen. And I was like, yeah, like you have to have some help, obviously, because you're laying flat, you're not sitting up. But there's stuff like that like, if you learn about it, if you hear about it and like just sort of ponder on it, right? Before you go into birth or before you go into that experience, then you can have some of that in your back pocket. Like, okay, as soon as all the tests are done, I want the baby with me as soon as possible. There's just stuff like that. So I always want moms to know about that too, that like, just because it is a C-section doesn't mean it has to be like the most medicalized thing in the universe. It can be a little bit more natural, but you have to know that going in or you're not going to get that. There's no way you're getting that without asking,
Yes, you have to be the one to carve that path. And like they could be playing a song in the OR if you wanted that. Somebody could be taking photos so that you have, because the memories can be foggy, but those sorts of things can mean the world later on. And having a clear drape or a dropped drape so that you can see the baby coming out if you want. There's even something called maternal assisted cesarean if your provider is down for that. And I think in the future many more will, where mother is like, gloved up, scrubbed up, and is actually lifting her own baby out of her abdomen. And so there's that if you wanted to partake a little bit more into it, if that wasn't going to make you squeamish, And then the thing well, if mom for some reason can't do skin to skin, then let's have partner do skin to skin. So they can be right there in the OR, sitting on a chair somewhere, net in the hair, but no shirt. Or like, baby tucked under the shirt. There is lots of different ways, like you said. And so these kinds of things take a little bit more intentional planning. And that's why we need to go there.
Yeah. I love that. Well, I know that we could talk for many more hours, but my podcast producer would not like that. So I want to finish up here with a couple little questions. I like to do just some fun rapid fire questions that are helpful and also let us get to know you a little better. So here we go. Are you ready?
Yep.
Okay, great. Okay, number 1, what is your favorite pregnancy snack?
Greek yogurt with honey drizzled on it, or cottage cheese mixed in with applesauce. And that one looks like vomit, I will admit, but it tastes so good.
Okay, I have not tried that, but I just heard someone say that the other day, so I need to try that because that sounds delicious. And like, what a great little treat. You're getting your protein.
Oh, it's so good. I crave it. Yeah.
I love it. Okay, number 2, what is a baby product you couldn't live without?
It's kind of related to it. A Silverette nipple covers
Oh,
or
yeah.
nipple like healing things because all my babies' mouths are tied when they come out and just absolutely rip my nipples apart. And so those things, I've tried every single cream and
Yeah.
ointment and thing under the sun, and there is nothing that heals nipples like the Silverettes.
Ooh, I love that. Okay, great tip. Most underrated self-care practice for moms.
For me, it's a 110-degree hot Epsom salt bath while you're reading your book at night after your kids go to sleep. So this is probably one of my most consistent, most helpful, most nourishing and fulfilling self-care things that I do for myself dang near every day. I do it probably 5 to 7 nights a week. And I got a bath thermometer, like a little floating like pool thermometer thing.
Yeah.
And I just turn my bath on to the hottest setting only until it starts to get cold, or I look at the bath water. I have to kind of monitor it. But sometimes people ask me, like, how do you get it that hot? First of all, I think that our hot water heaters are not set to like a safety point, which is the downside. But 110 for me is the key. And that's going to be too hot for some people. So work up into it. I think I did probably work up into it. I can't remember now. It's been a while. But I sweat my off, and I have lots of Epsom salts in there too, which I think has its added benefit. I think it helps me with detoxification. It helps me if I feel like I'm edging on being worn out or maybe going to get sick. It helps to activate the immune system in different ways. But also, it just brings me so much joy. It makes me feel really good. Like, I'm not a cold plunge girl. Getting cold is really stressful to my body.
Mm-hmm.
Getting hot so there is hyperthermia practices. Right now, we're all obsessed with cold. And I think some people do great with cold. Some people also probably would do better with hyperthermia.
Mm-hmm.
I am one of those people. So that's what I like to choose and partake in. Yes, is it stressful and is it hot and hard and my heart is pounding and like, I'm drinking so many it's like you're being in the sauna.
Yeah.
But then I read my book too. So it's like a little bit of a stack because those two things together just bring me such joy. And I think we underestimate the power of for me, I'm actually in it for like 45 minutes to an hour, but even just a 20-minute something that brings you joy, if it's a very high power boost in joy, makes all the world of difference in a hard day.
Yeah. Okay. I'm going to start upping my bath temperature then because I don't
Not when you're pregnant though.
Yeah. Right. Yes. Good.
Right. Yeah. Pregnant people, sorry, you guys all have to wait and you have to stay at like 100 degrees max.
Yeah.
But then the second that baby comes out of you and you're like feeling like you want to take a bath, you could get into much higher temps, even if you're breastfeeding, that's fine. And yeah, you're going to detox some breast milk, blah, blah, blah. I don't care. No, I think the benefits to you as a person are far outweigh any theoretical dumping of toxins into your breast milk for your baby.
Yeah, right. Yes, we could talk about that all day too, I'm sure. Birth playlist. Do you like silence, meditation, or pump up music?
Yeah, no. So I have this one playlist that I've listened to. I made 3 different playlists for my first birth. I made a pump up one. I made a very like sweet, soft, like, John Mayer kind of one. And then I made like yoga music, like oming and that kind of thing. And during that birth, I gravitated more towards the oming one anyway. And then for the last 3 births, I've listened to either that Om playlist or this other one that is by goodness, I can send you the link for it. It's a public playlist made by a woman with the Reconnected, that parenting account, Emma, whatever her name is. Either way, it's all kind of like Sanskrit yoga. It's not English, which I appreciate because then I'm not listening to it. You know what I mean? But it's kind of that ambience of yoga type music and a lot of deep low tones, which help me make those deep low tones. And it just kind of blends into the background. It's not something that I even like really perceive that much during my birth, but it helps me just get into this state of that trancy headspace where I'm not thinking anymore, because that's my biggest, everybody's going to have their own thing. That's my biggest roadblock in birth, is getting out of my own head and just really getting into that labor zone. And I think that sort of music helps me so much.
I love that. I remember my husband on this last birth, he was like, a couple of days later, he was like, why? Do you remember you had that song on your playlist? And it's like this really long song. I think it's like a Christian worship song, but it's like 12 minutes long. And it was like, and the main words are like, I'm going to wait on you. And he was like, why did you put that on there? It's like, you were waiting and waiting. And I was like, dude, I didn't even hear those words. Like, I don't know what you're talking about. And he just like thought it was so funny. I don't know. We were laughing so hard about it because he's like, that song just kept going. And it was like right before I was like transitioning. He's like, and the song's like, I'm going to wait on you. And like, he's like, I'm waiting on you. I was like, oh my God.
Like, we don't want to be waiting on this baby anymore. Like, change it to like, come out right now.
And like, one of the reasons I love that song is because it was playing in my C-section on my second one. It was when my son came out, that song. And so I was like, oh, I wanted it to play. And he's like, well, it played for a long time. And we were just waiting and waiting. Like, oh my gosh. Okay, last question. If you could go back and give your first time mom self one piece of advice, what would it be?
Oh my gosh.
I know it's a hard one.
If I could really go back, I would say get a second opinion. Get a second opinion about being told my son was not tongue-tied, because those first 3 weeks of his life and nursing him and getting mastitis twice, and he ripped off a chunk of my nipple and he would spit up pink because it had my blood in it. And it was the most painful, horrible thing ever. And then I went to a different lactation group, and this just like volunteer IBCLC who was there that day kind of heard me complaining about this and talking about it, looked in his mouth, was like, there's no way you're going to be able to nurse this baby. Like, what? This is such a tied mouth. Like, and it was just so validating for me, and also so shocking and confusing. And like, how could one person say no and then one person says yes? And but also looking at my symptoms, looking at his symptoms, he wasn't gaining weight. I was so freaked out. I was giving him so much donor milk and I was pumping and all the things. And it just, none of it lined up, because she told me, the first lady told me I didn't have enough milk, where I was actually an oversupplier, hence the mastitis.
Yeah.
Like, it could not have been worse advice. And I mean, I've forgiven her mentally in my head multiple times, but I'm just like, man, how do you make a mistake like that? But we're all human. And that's why if something is not lining up, something is not working, get a second opinion. Yeah, it is more money. It's so true. And like, if you can save for these sorts of things or put that on your registry, IBCLC, lactation support, postpartum support of any kind, it really is worth it, because then finally I got him revised. He started to gain a pound a week. He became the chunkiest, fattest baby ever. I had rocket milk. My nipples finally healed. There was so much sequelae from that. So I would say get a second opinion, but then also I also want to say everything is temporary. Like, even when you're in the depths of like, it feels like the worst you've ever felt, or you're just like, what did I do? I ruined my life. I ruined our life. Like, I've had all those thoughts before too, in moments, and it's sad to have those thoughts. But I think that there's so much going on with the hormones and the shift and the change and identity and like our capacity. And it's all just this opportunity where we are going to rise above, because we're moms and we're going to do it. We're still going to get there and learn how to manage all of these spinning plates. And those really, really tough times are just tough times. They're not the rest of your life. And I remember really specifically one time talking to my husband when our son was like maybe 3 months old. This is, again, our first baby. We were planning something far in the future, like 6 to 9 months out, like a trip. And he was talking about it. And I was like, babe, this is how stuck I was mentally. I could not extrapolate out in that moment that our son was actually going to be 6 to 9 months older. I was thinking about the trip with him at the age that he was then, at 3 months, and how hard everything was. And I was like, I'm not going to be able to do that. And he was like, babe, but like, no, he's going to be older, but I was so stuck. I'll never forget that. I was shocked at my own mental mistake in that. Like, why couldn't I see that? But I think it's easy in new motherhood sometimes, or any time, to really not be able to have that sort of perspective. So get a second opinion, and everything is temporary.
Yeah, totally. Thank you so much, Dr. Morgan. Before we go, can you tell us where everyone can find you, how they can work with you, all that sort of thing?
Yeah, absolutely. Okay, so my website is milkmedicine.com, MILK. And I'm very active on Instagram, just my name, Morgan MacDermott. And then my podcast, Healthy as a Mother. So we'll release an episode every week, and we talk about all the different topics, 2 naturopathic doctors discussing all of these types of things in depth. And, sometimes it's medical, sometimes it's more philosophical. I'd say a lot of the time it's medical. A couple of guest interviews as well. So those would probably be the main places, my website and following me on socials. If you want to see my crazy life, then make sure to watch stories, because I don't really post a lot of like this craziness of the day as feed posts, but I share a lot of it in my stories. And I try to be really transparent. You know, sometimes it's maybe a little too much. Like there should be a bit more of a filter, but
no, I think it's great. It's
good.
It's
not the way I am. I can't do it.
Yep. Yeah. We have to show all the, if we're going to show the good side, I think we got to show maybe we won't call it the bad. We'll call it the other side.
Yeah. I agree.
Okay. Thank you so much for joining us. You have been so helpful and it's been just a delight chatting with you. So thanks so much.
Thanks for having me.
Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder. Motherhood is athletic, and you're still the athlete you've always been. But it's not about going back. It's about moving forward intentionally and powerfully. If this episode resonated with you, I'd so appreciate it if you'd share it with a friend, leave a quick review, or rate the show. It helps more moms to hear what they need to believe, that every mom is an athlete. See you next time.